The toe bone's connected to the foot bone. The foot bone's connected to the ankle bone. The ankle bone's connected to the shin bone. The shin bone's connected to the knee bone. We got so many parts in so many sections. We need the bones to make.
Last week on Tibia, soon-to-be mother Jennifer finds out that she was pregnant after a one-night stand with David at a New Year's party. With David flying out to Nepal in pursuit of climbing the Himalayas, Jennifer is on her own.
Hi, doctor.
Oh, hi, Jennifer.
Hi.
Nice to meet you.
Nice to meet
Here,
you.
come in. So, here is the ultrasound that you requested from before.
Okay, so what is this right here?
Oh, that's actually your baby's hand.
But, okay, I don't understand. Last time I came to see you, my baby looks like a puddle with the tail, but it's totally different now. What?
Well, you see, you're in the 6th week of pregnancy, and during this time, your baby is starting to undergo a process called endochondral ossification.
Endochondral.
Endochondral ossification. It's a process in which bone starts to develop from high-end cartilage. Here, why don't I show you how this process is going on?
Yes, please.
So this is a high-end cartilage model. I keep it in my office for parents who want to know what's going on. First, mesenchyme develops into this model. It's essentially a loose matrix of cells in an extracellular matrix. A perichondrium, which has 2 layers, covers it and produces chondrocytes, cartilage cells which help our model grow.
So you're telling me that my kids is just made of cartilage. And also, I don't know what ossification means.
Well, not quite. The second step is where the ossification, which means bone remodeling, actually begins. The perichondrium stops developing chondrocytes and begins producing osteoblasts instead. Osteoblasts are bone-making cells that start off by making a collar of bone around the middle of the model, as seen here. But the chondrocytes don't go away. They actually start to get bigger at a point called the primary ossification center, here. Oh, and the perichondrium becomes the peristem.
So is that it? So the osteoblasts just continue making collars around the cartilage until my baby is born.
Well, of course not. You see, at this point, the bones don't have any blood vessels yet. We also need a space for bone marrow, as well as secondary ossification centers.
Oh, right. If there was a primary ossification center, there has to be a secondary ossification center, like that.
That's right. So the blood vessels do something called vascular invasion, where they basically penetrate the bone collar, enter the primary ossification center. The blood vessels start to hollow out the center, as you can see here, until a marrow cavity is formed, which is filled with the stem cells and blood. Some other things that happen are that osteoblasts begin in the cavity and deposit osteous tissue, which are a mineralized bone matrix.
And do you mineralize by drinking milk or something else? And it's the calcium, right?
Well, yes and no. You see, the osteoblasts will start calcifying the tissue. Although you have to realize that when this is happening, your baby is still a fetus.
Okay.
After calcification, the tissue will actually become trabecular bone, which, if you don't know, is spongy, arranged as a system of struts, and is usually the rounded end of long bones and invertebral and flat bones.
And what happens to the cartilage that was there before? Does it stick around?
Well, let's say we draw a bone here, right? Okay. The cartilage actually gets calcified, so it's going to travel up in a wave and down in a wave as it calcifies, and that will form the secondary ossification center, SOC. The last step after a secondary ossification center is formed is that it expands and generates a secondary marrow cavity. So this eventually becomes the secondary marrow cavity, and that's it, your baby is born. One thing to note though is that the secondary maral cavity also has blood vessels leaving it as the primary maral cavity.
Okay, thank you so much, Dr. Tibia. Is there anything else I should know?
Well, not much. You see, all of the information is actually in a pamphlet outside, and I would strongly recommend to pick one up on your way out.
Okay.
Thank you for coming
so
today.
much. Okay, there were two more steps to endochondral ossification that Dr. B didn't have time to tell me about. Let's see. Step 5, epiphysis. That's the rounded end, if I remember right, fills with spongy bone. The cartilage becomes restricted to the joint surface, and the epiphyseal plate, which is a wall separating the primary and secondary marrow cavities. This place will be the basic for bone elongation as my little baby grows out. But the next step is when the bone stops growing. The gap between the epiphysis and diaphysis ends.
Jen, where are you? I need help, quickly!
Kim, what happened? Are you okay? I'm at the doctor's right now. Are you at home? I'll be there in 15 minutes. Kim?
And now a note from our sponsors, MedBone. Have you or your loved ones ever broken a bone? Are you tired of being treated by ridiculous doctors with outrageous prices? Well, look no further. MedBone has created a new bone-breaking remedy to such cases. Our supplement immediately enters the bloodstream and hones in to the area of breakage. With new nanoparticle technology, MedBone will create hematoma within minutes of use. Then it will stimulate blood vessel growth, which provide the scaffolding for the growth of spongy bone. Within days, you or your loved ones can be limping around with a healed fracture. Call now for a quote on our new product. Limited calls and offers while supplies last. Still not convinced? MedBone has shown a 95% success rate when producing granulation tissue, soft callus, and hard callus. And if you call now, we'll also give you a cast to immobilize your fracture for just $49.99. Call now for your chance to get this one-in-a-lifetime deal. Approved by the man, the legend, Dr. Tibia Bone.
I approve.
MedBone takes no responsibility for any side effects, including heart attack, autoimmune disease, and even death. Effects may take up to 6 weeks in addition to the regular recovery period of 8 to 12 weeks. Our success rate is also made up. Your discretion is advised.
So many parts in so many sections. We need the bones to make the connection.
MedBone takes no responsibility for any side effects, including heart attack, autoimmune disease, and even death. Effects may take up to 6 weeks in addition to the regular recovery period of 8 to 12 weeks. Our success rate is also made up. Your discretion is advised.
I'm sorry.
Have you or your loved ones ever broken a bone? Are you tired of being treated by ridiculous doctors with outrageous prices? Well, Nook Loaf
Baby is ready to be born.